Welcome to this episode of Ignite Health, brought to you in partnership with Caribbean Surgery. This program, as always, is dedicated to empowering you, our wonderful viewers, with trusted medical information, expert insight, and practical advice to help you take better control of your health. As always, I am Dr. Surendra Persaud, the Medical Director at Caribbean Surgery, and your host. Each week, we break down important health topics and answer common questions and help you understand why and when it's time to seek medical care, because informing you helps you make better choices and can lead to a healthier life for you. In this episode, we will be exploring pancreatic cancer. So what is pancreatic cancer and why is it important to talk about? Pancreatic cancer is a disease where abnormal cells grow in the pancreas. Now that leads to the obvious question, where is the pancreas? What does it do? The pancreas is an organ that helps with the digestion and blood sugar control. It's one of those unique organs which has sort of a dual function. Scientifically, medically, we describe it as an exocrine function and an endocrine function. So it's an endocrine organ, it helps regulate our sugar, but it also produces chemicals that help us digest food. And we're going to talk about what are the warning signs. So what does the pancreas do, first of all? So all of our sugar control, the pancreas produces insulin and it produces other chemicals which help us raise our blood sugar and lower our blood sugar to ensure that we have glucose in our system. When the pancreas is not working properly, it can interfere with our blood sugar, so you get diabetic. Now the pancreas also secretes chemicals which help in the digestion. Now, where does the pancreas sit? The pancreas actually sits in the upper abdomen, more to the back. And so this is one of the reasons, as we discuss this, why it is very difficult to pick up pancreatic cancer. It's a smaller organ. It's sort of tucked away. So many times it takes a while for something to grow, for it to be large enough to impede before we're able to figure it out. Now, persons may want to know, is pancreatic cancer the same as diabetes, or is pancreatic cancer the same as pancreatitis? Because those are other words they would have heard. And the answer is no. Diabetes and pancreatitis are not pancreatic cancer. Diabetes is a very common medical condition where the patient has the inability to control their blood sugar, and pancreatitis is an inflammation of the pancreas from a variety of reasons. However, we do believe that long-standing pancreatitis and sudden changes in your diabetes control, so a patient who is diabetic or there's a sudden onset of diabetes, especially later in life, can be sort of that warning sign, that little flag that says, hey, let me make sure I look at my pancreas, let me speak to my doctor and understand whether I need to be investigated. Many of us who read on the internet will realize that many persons lose their life to pancreatic cancer. It's a relatively short time between when they are diagnosed and unfortunately when they die. So let's talk about Guyana and the Caribbean. Who in Guyana and the Caribbean do we want to pay extra attention to? As always, the vast majority of our cancers appear in persons of older age. So once you're above 55, speak to your doctor and say, hi, how do I evaluate, or do I need to evaluate myself for pancreatic cancer? Again, not surprising, smoking turns up here. And as I've mentioned multiple times on this program, there really is no good or appropriate dose of tobacco. If you're smoking, you need to speak to your doctor, you need to speak to your support group, you need to get as much help as possible so you quit smoking. Again, continue the list. Over 50, diabetic, smoking, people who have chronic alcohol abuse, because chronic alcohol abuse are one of the main risk factors for chronic pancreatitis. And so like tobacco, we would like you, whilst we want you to quit tobacco, we certainly want you to reduce your alcohol intake. So chronic pancreatitis is an independent risk factor, and a family history of pancreatic cancer. Obesity and other metabolic conditions, these are some of the cues that should drive you into a conversation with your doctor. Now, why should Caribbean families pay attention to this? We all know that in the Caribbean, smoking, alcohol abuse, diabetes, and the mere fact that as a people, we generally seek out our doctors at a later stage. And this, of course, increases the risk because every disease we are discussing is going to be discovered later when it's more advanced, and we really want to try and break that habit. Now, what are some of the early warning signs that are often missed that we should be talking about? Any change in your, and these signs are going to be very vague, okay? So persistent upper abdominal discomfort. As I mentioned, the pancreas is in the upper abdomen, more tucked to the back. So any persistent discomfort, appetite changes, you don't seem to have the appetite, you're losing weight, you're getting fatigued. Remember, the pancreas is helping us control our blood sugar, and it's also helping us with digestion. So subtle changes in the function of the pancreas will present in those vague symptoms. So you need to speak to your doctor. Now, what are the signs that or symptoms that you develop that require you to see your doctor immediately? And that would be jaundice. What is jaundice? We all know that jaundice is when the skin changes color, right? We get a yellowing of the skin. That is never normal. And persistent abdominal pain, changes in the color of the stool. If you look at your stool, when you have jaundice because of the blockage in the way we manage a certain particular bile and bile products, the stool will get lighter in color and the urine will get darker in color. So that's, if you notice changes in the color of your stool or changes in the color of your urine, that should warn you to go seek the advice of your doctor. Ongoing nausea, ongoing vomiting, okay? Now, what causes pancreatic cancer? Sadly, we do not have a single cause of pancreatic cancer. As with all cancers we discuss, we are all born with risk factors, something in our genetic makeup that puts it at higher risk. So pancreatic cancer similarly develops due to a combination of genetics, long-term inflammation of the pancreas, smoking, diabetes, some of the medical conditions. So to repeat that again, genetics, smoking, long-term inflammation, and metabolic conditions like diabetes. Now, why do we often diagnose pancreatic cancer so late? You will be seeing pictures, and I would urge you to go on the internet and look up pictures of where the pancreas is. And make sure you're looking at these pictures from the front and from the side, and you will realize the pancreas is actually more towards the back of the upper abdomen. When people get inflammations of the pancreas or pancreatitis, the pain is actually more in the back than sometimes in front. And so because of this, these symptoms are not specific enough, so people tend to ignore them. So this is the primary reason. Now, as with pretty much all cancers, they're growing. They're starting with one cell and they keep expanding and growing. So it takes a long time for this cancer to grow to where it begins to impinge on surrounding organs. And so it takes a very long time. Now, as you read, you will learn that there are tumors that occur, cancers that occur in the head of the pancreas, the tail of the pancreas. They're managed differently because of how close they are to different organs. So this means that if you don't ask the question, if you don't ask your physician and get a proper history and medical examination, no one is going to think about this. So if we start thinking about this, what should we do? What are the kind of imaging or blood tests, etc.? There is no blood test that is going to say, yes, this equals pancreatic cancer. What we have to do is some form of imaging. And what are the imaging techniques we are all familiar with? Everybody is familiar with an ultrasound. Everybody is familiar with CAT scan. Everybody is familiar with MRIs. Now, an ultrasound is essentially where we're using a machine to send sound waves into the body, and those waves are reflected and we get an image. Ultrasound is a little bit challenging where it comes to the pancreas because the fact that it is not close to the skin makes it more difficult. We also have a part of our large intestine that sits across the upper abdomen that interferes with the imaging. Now, there are ways in which we do an endoscopy where they pass a camera through the mouth, and that camera with an endoscopy can do an ultrasound because it's closer to the pancreas. But the two more common imaging modalities are CAT scan and MRI. Now, why do people prefer one over the other? Again, your doctor will discuss this with you. But remember, CT scans, CAT scan are a form of radiation. So very, very good, but it exposes you to radiation. MRI is a magnetic resonance imaging, does not expose you to radiation. But your doctor will discuss with you the pluses and minuses, because there are certain times when one test is better than the other. Now, who should be evaluated for clear symptoms? Coming back, you're losing weight and you are not actively trying to lose weight. That is something you should be concerned about, and you should come and see your doctor. You are diabetic, but all of a sudden your diabetes seems more difficult to control, and especially if you're over the age of 50. Anybody who has a family history of pancreatic cancer should be speaking to their doctor about how they check themselves. Generally speaking, with most cancers, if there's a family history of that cancer, whatever the recommendation is for when you start getting screened is usually 10 years before that family member discovered they had that cancer. Any persistent abdominal pain, any persistent back pain, you need to ask yourself and have this evaluated. So, to summarize, if you're having these symptoms, and again, remember these symptoms are very vague, you're not going to be thinking of them, you pretty much need to engage your doctor and ask the question. Then, this leads to the ultimate question. Is pancreatic cancer treatable? The answer with most cancers is yes, if found early. Because if you have a small cancer that is growing in a part of the pancreas that can be surgically removed, then it's generally gone. But in addition to surgery, there's chemotherapy, radiation therapy, and various combinations of these. But the reality, as you will learn in a second, is the outlook is not great. The vast majority of patients who have pancreatic cancer present very, very late. And because they are presenting very late, this has a negative effect on their survival and their quality of life. So what we want is early diagnosis, because we know that early diagnosis improves survival, improves your quality of life. Even when a cure is not possible, treatment can certainly relieve symptoms and extend life. So to pause and refresh on that is that, again, found early, we can treat it and we can certainly improve your symptoms. Found late, it is difficult. Can we prevent pancreatic cancer? Many times as we're getting and discussing health, we want to know, can we prevent certain conditions or can we reduce our risk? The answer, the single best thing you can do to reducing your risk is avoid smoking. In pancreatic cancer, we can't prevent it. There's no tablet, there's no treatment that's going to prevent you. What we are speaking about is reducing your risk. Number one way to reduce your risk, avoid smoking. Number two method of reducing your risk, limit your alcohol intake. 3, maintain a healthy weight. Keep yourself active, fruits, vegetables. If you have diabetes, work towards keeping your diabetes well controlled. And if you have any symptoms that are persisting, you need to speak to your doctors. Now in the Caribbean, families are usually the largest drivers of healthcare. So we are asking the families out here to encourage all of your loved ones to not ignore these symptoms. Sadly, many times as we are speaking to patients, we hear, yes, this has been going on for so long. And we ask the question, why didn't you? So we're asking families, speak to your family members, encourage them, inform them so we reduce fear, we reduce delays in care. We have this habit in the Caribbean of we don't want to know. But so much has changed in medicine, so much has improved in terms of what we can do. So we need to reduce fear, we need to reduce these delays, and we're asking family members to encourage their family to come in and seek this the medical care that they need. So what is the most important message we would like viewers in the Caribbean and especially at home here in Guyana to know? If symptoms don't feel right, and if the symptoms are not going away, get yourself checked. Because we are rarely discovering pancreatic cancer early. So unless you come through that door and speak to your doctor. So listening to your body and acting promptly can make a real difference. Please, please do not ignore these signs. Early care matters, and that is what is going to help you have a better outcome. On that note, this brings us to the end of this episode of Ignite Health in partnership with Caribbean Surgery. If there's one thing to remember, it's this. Early attention to your health can make all the difference. If you have symptoms or concerns, please, please don't ignore them. Speak with a qualified medical professional. As always, I am Dr. Surendra Persaud, the Medical Director of Caribbean Surgery, and thank you for watching, and thank you for choosing to stay informed.